everyone, and we are going to be talking about gut health today. We are going to be talking with Dr. Mary Pardee, who is a naturopathic medicine doctor and an IFM certified physician. She specializes in the gut and brain health. So she will be joining me in 1 second. Until then, hold on to your questions, and we can go through some of the questions you have. So just for 1 second, Dr. Mary would be joining me in 1 second. About the connection between the gut and the brain axis, I think all of us know right now. We will be talking about the microbiome. There you are. Hello, how are you?
Good. How are you doing?
I'm doing great. Thank you so much. I was
Thanks for
just
having me.
absolutely. So I was just telling our viewers that we'll be talking about the gut and gut health on overall. And Dr. Pardee is a naturopathic medicine doctor and a functional medicine doctor. So maybe you can tell us a little bit more about yourself before we go into the questions.
Absolutely. Yeah. So I specialize in integrative gastro, so gut health. So a lot of people with IBS, inflammatory bowel disease like Crohn's and colitis, but also things like reflux, things that a lot of people experience on a daily basis and may even consider normal, like bloating and things like that. But it might affect your mood, or it might affect an aspect of your life where if it wasn't there, you could actually function at a higher level. And I specialize in this because I had my own gut health issues when I was younger. So it was through my own self-healing journey where I really wanted to become a doctor that I didn't have access to when I was a younger girl.
Wow. So let's talk, this is very interesting. So let's talk a little bit about your personal journey, if you don't, if you would like to share us, because I think that makes, the personal stories are always the best.
Yeah, exactly. So I was diagnosed with IBS at a really young age, and I had seen a ton of different doctors. I had had a colonoscopy when I was really young, endoscopy, seen a lot of gastroenterologists. And then it wasn't until I started to go into the more alternative field, as we call it, alternative medicine, that I started to actually feel better. And and then I decided to go to naturopathic medical school because I really believed in it.
Yeah.
And there was one time I remember I had seen a doctor, a conventional gastroenterologist, and he looked at my file, and it was like this big, thick medical chart because I had seen so many doctors before. And he was like, listen, like, you've done everything. There's nothing else that we can do for you. Mm-hmm. And I left that appointment just really defeated and really upset and just feeling like, okay, they're basically telling me there's no other options and I have to live with this for the rest of my life. And so it was at that point where I was like, I don't want people to feel like that. I don't think that there should be a sense of helplessness that somebody leaves an appointment with. Because I really do believe the body has an innate ability to heal itself if you give it the right tools to do so. And you have to be open to the tools. The tools might be, not just supplements, not just herbs. It may be meditation. It may be lifestyle things that are harder to implement. But I think that if you really want to truly heal and you implement all of the things, then you can get better. And so that was kind of part of my healing journey, but I ended up healing myself throughout medical school with the help of other naturopathic doctors and functional medicine doctors. And that's where I am today, just wanting to kind of pass on the knowledge that I've gained throughout my journey.
That's fascinating. So you did maybe just a little bit more, like, did you include meditation as well as diet? I mean, what were the tools for your healing? And then now you're applying the same tools to your clients now, right? I mean, that's really what's happening.
Yeah, and I see that everybody has their own journey. So like, my journey is not what all of my patients experience. For me personally, my diet was like, I was, a nutrition student, an undergraduate. I was eating really well. I was exercising. I had already tried like a lot of herbs and things like that. So for me, the missing piece ended up being mindset, meditation, like spirituality, like really getting in tune into like past traumas and things that were inhibiting me from that mental, emotional perspective. I now see, because then I'm like, oh, this must be for everybody, right? But after you see a few people, you realize some people they've already gone through and dealt with past traumas, and they're already meditating, but they're not eating well. They're eating the standard American diet. They're not walking. They're not exercising. So I think everybody's journey kind of unfolds differently, and you have different stages of it. So figuring out where your weaknesses are or where you could still improve upon is really important, because it's not going to be the same as, everybody that experiences the same symptoms even.
Got it, got it. No, I think that makes complete sense. So all of us are talking about microbiome. You read the papers, and then there's an article in Wall Street Journal. I mean, so let's just help us understand a little bit in a simple, plain English, which all the users can understand, the connection with respect to the gut.
Yeah, so your gut, so you have a microbiome in a lot of different areas in your body. We have a gut microbiome, but we also have a skin microbiome. We now know we have a uterine microbiome, even in the placenta. It's no longer considered sterile. So you have microbiomes everywhere. You've got it in your ears and your sinuses. When we talk about the gut microbiome, we're referring to the collection of microorganisms that reside in the intestinal tract, all the way from the mouth to the lower part of the colon. So you've got different bugs in different places and in different concentrations. You've got fungi, you've got bacteria, you have viruses. So you have a collection of different microorganisms there, but it's about 100 trillion microorganisms. So it's in the biggest concentration in your intestinal tract, tons of bugs there. And the real magic comes out when you realize that those 100 trillion microorganisms encode for a ton of proteins. So the purpose of a genome, which is the collection of actual genes, right? So we have human genes that we got from mom and some from dad. And those genes, the purpose of them is to make proteins. Proteins are the building blocks of life. So they have like the roadmap to say, okay, we're going to use this amino acid, then this amino acid, and in conjunction, those are proteins. And those proteins can be hormones, they can be parts of a cell that we need for function, but those are really the building blocks of life. Now, it turns out we have about 20 million microbial genes. So those microbes encode for 20 million genes. In comparison, we have about 20,000 human genes. So we have way more microbial genes than we have human genes. And if you do the math, we end up being less than 1% human from a genetic perspective. And so one of the terms that we use now is the holobiont, meaning the collection of bacterial genes and human genes. So, it kind of questions, are we human, are we bacteria, or are we a combination thereof? And we're definitely a combination of. And that's because our health depends on the health of our gut microbiome. These guys are producing those proteins, and those proteins interact with our human cells, and they can either turn things on, turn things off from a genetic perspective, but they can also go up to the brain and actually regulate neuroinflammation. We know that neuroinflammation has to do with mood, anxiety, depression. It can talk to our liver through the liver-gut axis and either, enhance metabolism or reduce metabolism, can regulate sleep patterns. So the gut microbiome interacts with us in so many different ways, affecting mood and all of these different things that we have to take it into consideration when we talk about health issues, and that's where like the gut-brain axis comes from, is that the health of your gut can actually affect the health of your brain. And the reverse is always true. The brain can affect the gut.
That's fascinating. I mean, gut microbiome is very social with the entire body. Like it's talking to the whole system. That's what is happening in all of our bodies, for that matter. Fascinating.
Yeah, super fascinating. And we always focus on the gut-brain axis, but you got to know there's a gut-skin axis, there's a gut-liver axis, there's a gut uterine axis, there's all of the axes.
Who would have thought gut is so important? Like, a few years back, I don't think many people, we never heard about all these gut connection with all these, gut-brain axis, and you're talking about the gut-skin axis that's coming up in the last few years. So let's talk a little bit about the gut-related issues, like acid reflux you talked about. What are the early signs and symptoms that we should be looking at? Bloating you mentioned a little bit, but what are the other things?
Yeah, in terms of just overall gut health, what you want to be looking for is, do you have bloating after meals that doesn't go away? It kind of stays or gets worse throughout the day. And so one of the misconceptions is that you shouldn't have any bloating at all. And that's not true. If you eat an amount of food that takes up this much room, right, from a volume perspective, you're going to have bloating that takes up this much room after you eat. It's just a volume thing. But what should happen is after you're digesting that food, it should start to move down the intestinal tract into the small intestine, disperse, and then you shouldn't feel like you have a food baby for 4 hours afterwards. And so it's bloating that kind of accumulates throughout the day or affects your quality of life in some way, meaning that you're passing gas like all of the time. Technically, it's more than 10 passing gas episodes each day. So if it's less than that, that's considered normal. I go more for the 5 range because I think that's a little bit more, doable for most people. And then you don't want to have reflux. So you don't want to have any chest discomfort or feeling any food coming up into your esophagus as well. So that's also not normal. You want to be having 1 full bowel movement each day and feel like you're fully voiding. You can have up to 3 or 4 bowel movements, and that's still normal, but you do want to feel like you're fully voiding. And you want your bowels to be well formed. So you don't want them to be water, diarrhea, and you also don't want them to be like those little hard rabbit pellets, which means that you're constipated. And so this is kind of what we're looking at when we're talking about ideal gut health. But as humans, you're going to have fluctuations, and the fluctuations are fine. You just want to make sure on average it's not affecting your daily life. It's not affecting your mood. You don't have to map out all of the bathrooms on your trips, which a lot of people with IBS will know where all the bathrooms are. You should really not be thinking about your gut all the time.
Yeah. And interestingly, you talked about the bowel movements. So let's talk a little bit about our poop, which is like a yucky topic right now. All of us in the morning, I think we've already gone through our bowel movements, hopefully. But I think, what does our poop tell us? It was a very interesting post on your Instagram page also that I noticed, and I thought it'd be very interesting for us to understand our users, all of us.
Yeah, absolutely. It's a taboo topic, so people aren't really talking about poop. Even when you go to the doctor, they're not really, asking you exactly what your poop is looking like. And it's really important because it gives you a good idea of what's going on. So the first thing I'm always talking about with people is the consistency of your bowels. And so if you're at home, watching this, you can Google Bristol stool chart. And this Bristol stool chart is like, the end all be all in terms of consistency. It's what we go by in medicine to determine, okay, is your gut moving too slow? Mm-hmm. And when your gut moves too slow, what happens is that your body absorbs all of the water that's in the colon and the intestines. And the reason behind that is because it was sitting there too long, and so that it was able to fully extract all the water versus leave some of the water behind. What happens when it moves too slow and all of the water is extracted is that you end up with these hard little pellets. They're dehydrated pellets. You can actually see it in the stool. It's like no water was left in there. And so the issue is the motility, not that the stool is hard. So the hard stool is just a symptom of a slow motility, slowed digestive tract. And so we want to know, why is your intestines moving so slowly? Is it an overgrowth of bacteria that's slowing it down because they're producing methane, and methane gases do slow down the intestinal tract? Do you have gastroparesis? What is going on there that's really delaying motility is the next question. On the flip side, when you have loose stools, there's way too much water that's left in the stool, so it becomes watery, diarrhea. Then we ask, why are things moving so quickly through the intestinal tract? Why aren't we absorbing? It may be a malabsorptive issue like lactose intolerance, which is really common, or, celiac disease, which also we can see in people where you're not able to digest gluten. So lactose is going to be milk allergy, right? Or intolerance, I should say. And then you have fat malabsorption issues. So a whole host of different things that can speed up the intestinal tract and not let you absorb all of the water in there, leading to looser stools too. So that's like the consistency part of it to think about. And then you also want to look at what color your stools are too. And so usually they should be brown because they should contain the byproducts of the breakdown of red blood cells called bilirubin, and bilirubin makes it a brown color. But if they're pale, say they're like clay colored, then the bilirubin's not in there. So you want to look at gallbladder health. There's something going on from a gallbladder perspective, which can be, something that can happen if your gallbladder's not functioning properly. You can also have yellow stools, and that can be, okay, you ate a ton of carrots and they're this yellowish orange, which is normal if you eat a ton of carrots. But it also can show that you have fat malabsorption when they're yellow, which isn't normal. So you'd want to talk to your doctor about that. And then red stools could be you ate a ton of beets, or it could be that you have blood in the stool. So you'd also want to talk to your doctor.
Someone is asking about the black. Someone is asking a question on the black stool. What is that?
Yeah, and black stool can be two things. It could be that you have blood in the stool that's higher up in the GI tract. So say you had an ulcer in the stomach. Sometimes you can have black stools because it's all oxidized blood that comes out. So that is not normal, and you'd want to talk to your doctor if you have black stools for sure. It could also be if you're in the biohacking and wellness world that you took activated charcoal to detoxify or something, and then you can get black stools from a supplementation too. But if you're not taking that charcoal and you do have black stools, then you must talk to your doctor because you want to make sure that there's no bleeding going on in the GI tract.
Got it. I think that's fascinating. You know, the color of your stool and the way you describe, I think it's fascinating, and most of us never pay attention unless it's a loose motions or very, like pellets you're talking about. So let's talk a little bit about the functional medicine approach. You know, how is it different? And you've gone through that yourself. And what do you suggest, for all the viewers?
Yeah, in terms of just gut health in general.
No, I think specifically on gut health, what is the functional medicine approach? Well, we talked about it a little bit with your personal journey, but maybe you can talk a little bit about how you, like when your clients would come in, what would be the tools that you would tell them? Maybe from that angle, we can approach this.
Yeah, absolutely. So what happens when people come to see us, what we do first is we ask them a lot of questions. So I'm actually showing them the Bristol stools chart. They're telling me, what their stools fluctuate with. And then after we get a good idea of what's going on by talking to somebody, and I mean, we're talking for about an hour about their bowel habits, about their family health, about all, diet, exercise, lifestyle. Yeah. Then we're going to recommend any lab testing. And so this is one aspect that differentiates naturopathic medicine, functional medicine from conventional medicine, is that we usually do more lab testing than the conventional side would do. So we want to dig a little bit deeper. Yeah. And so with gut issues, we're looking at thyroid function, but we're not just running a TSH, which is thyroid stimulating hormone. We're going to run a full thyroid panel looking for Hashimoto's, making sure that your free thyroid hormones are optimal. So, we're going to dig deeper into each area to make sure that we're not missing something. And this is because usually when people come to see us, they've already seen a conventional gastroenterologist. Yeah. They've already seen their primary care doctor. They haven't received results from Western conventional medicine, so they want an alternative approach to it. And so we will do a full conventional workup, but we'll also do a little bit more digging. So we could be looking for H. pylori if somebody has, any reflux that's not going away, or dyspepsia, which is the kind of this feeling after a meal that you feel unsettled. Mm-hmm. We might be doing a stool analysis depending on the symptoms that you present with. We also might do something called an organic acids test, which looks at the urine metabolites of certain microbes in the intestines. And those are both testing that your conventional won't do. And then we also may be doing a test to look for small intestinal bacterial overgrowth. So that's one of our specialties at Modern Med, is looking at SIBO or SIFO. And this is going to be a breath test for small intestinal bacterial overgrowth. So you're going to blow into little tubes. You can do it in the comfort of your own home. But it tells us if you have too much of a certain kind of bacteria in your intestines. And this bacteria isn't bad. It's actually normal bacteria, but it can overgrow when you have something going on that's changing motility. Yeah. So in general, that's where we start to differentiate from conventional medicine, is just the testing is going to be more in depth. The other thing is going to be the treatments are going to be different too. So we really like an integrative method for treating people. So it's not that we're anti-medications. I think that they can be very useful in some instances. But if we can treat everything naturally with diet, exercise, and lifestyle, then we'll do that. If we need herbs, vitamins, and minerals, and we'll add those in. And if we need prescriptions, we'll also use them. But we'll use them for an acute period of time versus trying to put somebody on something for a long period of time. So we have a different therapeutic order that we go through.
So that would be mainly you're focusing on the diet, exercise, and some supplements like herbs, any particular herbs or any herbs that has scientific evidence, right?
We use a ton of different herbs, and it's going to be dependent on the person, and then it's going to be dependent on the lab work that comes back. For instance, berberine is a great antimicrobial herb. It can be more constipating. So if somebody's constipated, I might choose something like oregano or neem instead if they come back with a SIBO positive test. And so, we have a whole range of herbs to choose from. And herbs are amazing because they usually cover more bases than a pharmaceutical does. So you've got an antibiotic, and all it does is kill bacteria, right? Yeah. But you can also have an antimicrobial herb that also has antifungal properties. So herbs sometimes cover a wider range of microorganisms and can be a little bit more inclusive.
Yeah, yeah, fascinating, fascinating. I think I love your personal story. How, you know, how you weaved it into it, and now you're applying to the clients. I think it's a very inspiring story. Anything else you'd like to add before we wrap up? I really enjoyed our session, and I hope our viewers find the same. Yeah, well, I see a clap here. Someone is saying clapping. That's good.
Oh, thanks.
If there's any feedback, any comments, you're welcome to do that. You know, these are very small sessions we do, but you're welcome to send us message. But anything else you'd like to add before we wrap up?
And nothing on my end. If people are interested in working one-on-one with a practitioner, you can visit our Instagram, which is Modern Med, or my own Instagram, and there's a link in the bio to set up a complimentary 10 or 15-minute phone call with one of our doctors, health coaches, to see if we're a good fit for you. And DM me. So I like interacting with people one-on-one as well, and let us know how we can help.
Someone is asking a question on that. What do you recommend for constipation? You know, this is not a medical advice session, by the way, but maybe you can just comment on this a little bit.
Yeah, and I think it's important to make that comment because constipation can be caused by so many things, and you want to know why you're constipated first. It's really important. So, you know, if for instance, causes of constipation could be that you have SIBO, you have an overgrowth of methane that's slowing down the GI tract. Constipation can also be that you have colorectal cancer. And I never like to scare people, but it's important that you're evaluated by a doctor because you may need a colonoscopy if you just have constipation, especially if it's new onset constipation and you haven't had it for your entire life starting in childhood. It could be a thyroid disorder, hypothyroidism. You're not going to cure constipation due to hypothyroidism if you take an herb, right? So you really want to make sure you know why. Otherwise, you're going to start chasing your tail and you're going to drive yourself crazy. And then you're going to think natural medicine doesn't work because you tried, you know, some of the herbs for constipation and it didn't help. That being said, if you go and you have none of the issues going on and it's slow, herbs like ginger, things that can speed up the GI tract can help with constipation, making sure you're drinking enough water. So about 1.5 liters or half your body weight in ounces of water per day can help with constipation. Certain foods like papaya can help with constipation. Cayenne pepper can help with constipation. So there's so many different great herbs and spices and things that you can add to your diet that can help with constipation, but find out why you're constipated first.
So try the self-care remedies first, and if they don't work for a certain amount of time, then, you know, consult with a physician. Thank you. Okay, thank you. All right, well, thank you so much, Dr. Mary, and I think it's amazing. With that, I'd like to end this session, and thank you so much for being with us.
Thank you for having me. I appreciate it. Have a great weekend.
Yes, you too. Great weekend. Bye-bye.
Bye.